Welcome to my presentation, Understanding Multiple Sclerosis for Structure and Function of the Human Body, presented by Nikki Hiddle. What is MS? Multiple sclerosis, or MS, involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system, which is made up of the brain, spinal cord, and optic nerves. The exact antigen or target that the immune cells are sensitized to attack remains unknown, which is why MS is considered by many experts to be immune-mediated rather than an autoimmune disease. I'd like to present to you some interesting facts about multiple sclerosis. The course of the disease is unpredictable and no two people will experience the same set of symptoms. An estimated 2,500,000 around the world have been diagnosed with multiple sclerosis. In countries further from the equator, the incidence of MS increases. More than 400,000 people in the United States have been diagnosed with MS. About 45% of those people with MS are not severely impacted by the disease. When comparing the effects to women and men, MS affects more women than men with a ratio of 2 to 1. So what happens when you have MS? Within the central nervous system, the immune system attacks myelin. Myelin is the protective coating around the nerve fibers in the central nervous system. This is the primary target of the immune attack in multiple sclerosis. The fatty substance that surrounds and insulates the nerve fibers as well as the nerve fibers themselves. The damaged myelin forms scar tissue, also known as sclerosis, which is what gives the disease its name. When any part of the myelin sheath or nerve fiber is damaged or destroyed, nerve impulses traveling to and from the brain and spinal cord are distorted or interrupted, producing a wide variety of symptoms. The disease is thought to be triggered in a genetically susceptible individual by a combination of one or more environmental factors. People with MS typically experience one of 4 disease courses, which can be mild, moderate, or severe. In multiple sclerosis, within the immune system, T cells pass from the bloodstream into the central nervous system to attack the myelin coating around the nerve fibers. This leads to a variety of symptoms. Some of the symptoms that people can experience are fatigue, numbness, tingling, balance and coordination problems, spasticity, vision problems, pain, bladder dysfunction, constipation, dizziness and vertigo, sexual dysfunction, depression, cognitive dysfunction, anxiety, and emotional changes, as well as speech and voice disorders. Again, no two people will experience the exact same symptoms. How is this diagnosed? Because multiple sclerosis, to a certain degree, remains a mystery, there are no symptoms or physical finding or lab tests that by themselves will result in a diagnosis of multiple sclerosis. In order to diagnose a patient with MS, the physician must find evidence of damage in at least 2 separate areas of the central nervous system, which includes the brain, spinal cord, and optic nerves, and find evidence that the damage occurred at 2 different points in time, and rule out all other possible diagnoses. Once diagnosed, what can be done to treat the disease? As of presently, multiple sclerosis is not a curable condition. The use of medications have been approved to treat relapsing forms of MS. These medications will reduce the frequency and severity of relapses. Some of these medications include bedaciron, Avonex, Copaxone, Novatrone, Tysabri, Extavia, Rebif, Tecfidera, Gilenya, and Obazeo. These medications are either administered subcutaneously, which is injected under the skin, or intramuscular, which means the injection goes directly into the muscle. As stated previously, there is no cure for the disease. Sometimes those that experience these attacks are provoked by something, for example, a fever. This is when abortive therapy is utilized and the length of the attack is shortened in duration or alleviated by the use of steroids. When referring to preventative treatments of multiple sclerosis, these are the medications that were referenced previously. Symptomatic therapies include use of physical and occupational therapies. This will help individuals that suffer to improve and maintain the ability to function in a daily routine. Again, there is no cure. Those impacted by multiple sclerosis just learn to cope with the right combination of medicine and therapies. I thank you for taking the time to listen to my presentation and to better understand multiple sclerosis. Please see the final slide for references in which the data was gathered and collected for this presentation. Thank you.